Hello everyone, my name is Daniel Watenga and I am the founder and executive director of Partners for Health Individuals and Communities, PHIIC Uganda. Today, I am so excited to share with you about the transformative journey of PHIIC. PHIIC was started in year 2022 as a youth-led non-profit organization based in Uganda with the main goal of improving health of Ugandans. We identified 6 key operating areas that we work around. 1 is capacity building, 2 is disease prevention and control, 3 is sexual and reproductive health and rights, 4 is improving nutrition, 5 is water, sanitation and hygiene, and 6 is in provision of medical care for needy, vulnerable individuals. In year 2024, PHIIC has been implementing a project called Empowering Adolescents and Youth for Sustainable Sexual and Reproductive Health, with support from Hivos under the regional SRHR fund. But beyond just implementing this project, Hivos has supported PHIIC to develop its organizational capacity in areas of governance and leadership, in financial management, program design and implementation, and resource mobilization, but also most importantly, in growing visibility of the organization. For example, we've been able to develop and strengthen some of the key organizational policies that we didn't have in place when our relationship with Hivos began. We've, for example, been able to develop the financial management policy, the procurement policy, the board charter, and strengthen the human resource manual of procedures and policies. Most importantly, we've put together the first board of directors for PHIIC, and Hivos supported us in orienting the board of directors so that then we'll be on the same line with the board to understand the vision, the mission of the organization and where the organization is going, and to ensure that the board is strategic enough to support growth and development of PHIIC. So cognizant of the challenges that young people face in accessing information and services regarding SRHR and the general landscape of SRHR in the region and in Uganda. For example, in Uganda, we are facing a 24% teenage pregnancy. We are facing very high rates of HIV spread among young people, and also we are experiencing increased mortalities and morbidities due to pregnancy-related complications and unsafe abortions. We developed this project called Empowering Adolescents and Youth for Sustainable Sexual Reproductive Health with an intention of improving the outcomes of sexual and reproductive health. And we employed what we call a biostructure-social approach that we've been using to ensure that young people access biomedical information regarding SRHR, regarding the body changes that they experience in adolescence, regarding their body anatomy, regarding HIV and STIs and their prevention, but also to ensure that we strengthen the structural systems that support access to information and services and ensure linkage young people who need these services and those who have had violations to support to relevant support systems. But also what we've been doing thirdly is that we ensure that there is empowerment of the communities and young people to ensure that there is dismantling of social and cultural practices that are actually harmful. For example, child marriage, that for example, gender stereotypes that instead have fueled gender inequalities that have seen increased cases of gender-based violence. So then what we have done is we have worked with different stakeholders to ensure that young people access this information. We've gone to schools to ensure that we do IEC sessions with young people to give them this biomedical information, but we've also engaged other stakeholders like district leadership, the health workers within different public and private health facilities, and trained different health workers in delivery in form of mentorship trainings to be able to deliver information regarding SRHR and also change their attitudes and perspective towards access of SRHR information and services by young people. We've also been very ardent at actually spearheading and advocating for policy strengthening to ensure access to information and services regarding SRHR. So over time, we've seen an improvement and enhanced knowledge around SRHR. So through various engagement with the district health leadership and the leadership of different health facilities, we've advocated for creation of safe spaces in the form of adolescent and youth corners within health facilities that will ensure that young people access SRHR information and services safely. So over this period of implementation, we've seen some of the facilities actually designate spaces for young people so that these young people can access information and services that they require, that they can be able to do consultation, that they can be able to seek information without fearing to actually approach health workers. But also, most importantly, this mentorship trainings and engagement of health workers has seen change of attitudes and perspectives of health workers towards actually offering services regarding SRHR to young people. So this is something that we have really achieved. So what we've also done is we've integrated climate change messages and gender equality to ensure that that these issues are concurrently handled, because we realize that climate change and gender inequality are key cross-cutting issues that affect access to information and services regarding SRHR. So in our sessions, we have incorporated climate action, ensure that we drive adaptation and mitigation of effects of climate change, but also we've done messaging to ensure gender equality. We are going to see a video of a young girl in one of the schools that we've been working with, sharing some of the information that she learned in some of these IEC sessions that we held in schools.
My name is Nalunji Evans, a student at Highfield High School of East Africa, located in Nalvule, Sana, and I'm in senior 2 class. And patterns for health individuals and communities came to our school and had a visit and educated us about this sexual and transmitted benefits. And as me an individual, I learned different things, e.g., how the prevention and spread of AIDS. And as me, AIDS is spread through having unprotected sex with partners, through sharing sharp objects, e.g. razor blades. And the prevention is, as we adolescents, we should not have sex before the right time of marriage. I'm advising you, all my fellow teenagers, those in senior 1, senior 2, senior 3, senior 4, should not have sex with any individual, because you're still in school and your future is bright. You should not have any pregnancy, because pregnancy it's just a problem. And the other things I learned about gonorrhea, because gonorrhea is spread through having sex with an infected person. If you're a man, you have sex. If you're a man, you have gonorrhea and plus sex with a woman who is free from it, that woman gets what? Gonorrhea. So I'm advising you all, before playing sex with your partner, go for a checkup and see if both of you are safe. We also learned about the climatic changes that affect we girls.
So then we think, from our end, Hivos' regional SRHR fund has been very instrumental in supporting grassroots movements like PHIIC to be able to create the change that they desire and influence their context. Beyond just supporting a project to be implemented, they have supported organizations at the grassroots to see that they grow and have their initiatives sustained for a longer time. So we really want to thank Hivos for trusting us and for availing us their resources to ensure that our initiatives are actually implemented, but also for supporting us in developing our capacity to have our initiatives be meaningful and reach our desired beneficiaries. Thank you very much.